Guys, this is Dr. Nelson at Trinity Orthodontics. I wanted to talk to you today about TMJ problems. So what TMJ stands for is temporomandibular joint. That's why we call it TMJ, because it's kind of a mouthful. And the temporomandibular joint, or the TMJ, is basically the jaw joint right here. Okay, the main problem that people have with TMJ problems is pain in the side of their head or their face, and they can sometimes have clicking and popping of their jaw joint. The clicking and popping of the jaw joint is caused by this little plastic thing you can see here on my plastic skull named Finley. I had a little British girl who named him Finley years ago. So this is Finley. Right here, you can see there's a little yellow thing right there. That is the representation of that little disc on that little video over there. So if that disc isn't tracking with the lower jaw when it opens, that's what causes clicking and popping. So this is one of the weird things about this jaw joint, is that it only works, or excuse me, this is the only jaw in the entire of the body that does these weird movements. So I'm going to show you what those are. So when you first start opening your mouth like so, the lower jaw pivots in the jaw joint just like your elbow does, like a ball and socket joint is called, if you remember that from like 8th grade biology class. But when you get past halfway, the lower jaw actually slides out of the joint. Weird, huh? So if you look, you can see over here. So when you get to the halfway point of opening, the lower jaw slides out of the joint, okay? If that disc is not tracking with the lower jaw, then sometimes you cannot open because the disc will be in the way of you opening. Or there's a clicking noise, and that clicking noise is the disc actually clicking back into its ideal position. That is why after the click happens, you can actually open your mouth wider. And then when you close again, sometimes you can hear it actually click back out of position a little bit. Okay? So the other component of a TMJ problem is the muscles that make the jaw move. Okay? So the main muscle that makes the jaw open and do this sliding forward out of the joint is right inside there underneath the cheekbone. So that's where it attaches inside the skull. It's like underneath the eye. Okay? And so that muscle is right here on the video. It's called the lateral pterygoid muscle. And so this muscle moves the jaw forward, but because there's two, it also moves the jaw from side to side like so. And if there is imbalances in the bite, then it's the job of the lateral pterygoid when you bite together and you're chewing to make sure that your teeth are fitting together as ideally as possible. And so if there's imbalance in the teeth and this whole chewing system, that is what tends to cause TMJ problems. So you can get TMJ problems from chronic misuse, I'll call it, of your jaw muscles and the jaw joints by clenching and grinding your teeth. That can tend to cause the muscles to get really sore. And if this lateral pterygoid muscle has to work really hard to find the most comfortable bite, and you're clenching and grinding your teeth, or you get some kind of trauma, then that muscle can start spasming and contracting, and you can actually get like a Charlie horse in that muscle. And then that muscle pulls a disc out of alignment, and then you start having the clicking and popping as that muscle gets really, really tight. So TMJ therapy is basically designed to get that muscle and any of the other muscles that are sore in your head and face, because muscles are very social beasts, and if one hurts, they all want to hurt. So very, very social, always want to belong to the same group. So we always have to work doing physical therapy, which is pretty simple. Just do some exercises and stuff at home. It's not that complicated. And then bring balance to the bite. And so a lot of times that requires us to go in and make changes in the positions of the teeth. So we have to do orthodontic treatment. In my practice, I only use Invisalign for treating these kinds of problems because the clear Invisalign aligners kind of cushion the bite. So if the bite is off a little bit, then, or off a lot, then the aligners cushion that. So right away, that makes the lateral pterygoid muscles start to relax a little bit. So it's very common for a lot of doctors to treat TMJ problems with these thick pieces of plastic that are called splints. And I don't really use those anymore. I used to back in the day when I was first learning how to do TMJ treatment. But splints, for the most part, and there's always exceptions to every rule, excuse me, but most of the time splints are just a Band-Aid for what the underlying problem is, which is a mismatch of the teeth and the bite being off. So you can make an ideal bite by grinding the bite into these plastic or acrylic splints. But the problem is once you wear a splint and you get your bite balanced and you feel great, then when you take the splint out, you're left with your bad bite. So then you have to do orthodontic treatment to get the bite fixed because nobody wants to be wearing a splint forever and ever and ever. So the problem with split therapy is it takes a pretty long time and it's expensive. And then after that, then you have to have another expensive orthodontic treatment. So by using Invisalign, we can get rid of that whole splint component. So you don't have to pay for the splints, which I've heard that a lot of the TMJ experts charge anywhere from $4,000 to $6,000 just for splints. And then after that, you've got to go to the orthodontist and get your bite together, and that could be another $6,000 to $8,000 for the orthodontic treatment afterwards. So I can eliminate all of the time that's necessary for splint therapy, all of the cost associated with splint therapy, just by starting off with Invisalign from the get-go and doing all the treatment with Invisalign and doing the physical therapy that we need to do. And I would say I'm like 99% successful on getting people out of pain, getting rid of the clicking and popping in their jaw joints. And so some people, I will say, if they've had this clicking and popping jaw joint for a long, long time, sometimes it's so distorted that you can never get the clicking and popping to totally go away. But at least we can get rid of the pain, and we can get bites comfortable, and we can have very happy patients when we get done in, a year, 18 months, something like that, versus doing 6 to 12 months of splints, then 2 to 3 years of orthodontics, and $12,000 worth of treatment. So treating TMJ problems, in my opinion, isn't as difficult as a lot of doctors would lead patients to believe. So I'm not sure why that is, but I don't know, maybe my superpower is that I can take very complex things and distill it down into something that's very simple and predictable and easy to work with versus having it the other way, which is complicated, time-intensive, expensive, all the things that nobody really wants to deal with. So if you feel like you're having TMJ problems, then please come see me, because a lot of times you'll find out it's going to be easier to correct than you thought, and it's not going to be as expensive maybe as you thought. So come visit me at Trinity Orthodontics. Our phone number is 303-427-5000. And this is what I do. I'm an expert on fixing TMJ problems. So one of the things that, a couple things I want to say before we sign off here. Number one is it's not normal for your jaw to click and pop. And the earlier we can address the problem, the easier it is to correct. So that's number one. Number two, I've found out recently that a lot of people think that they're supposed to have their teeth touching all the time. Like especially during the day, that their teeth are always supposed to be touching, and that is not true. So if you find that your teeth are touching during the day, then stop it. That's not helping. You're gonna start clenching and grinding your teeth. In fact, that's probably what you're doing is clenching and grinding your teeth at that particular point in time. So if you can teach yourself to not have your teeth touching, especially when there's not food or something in your mouth, and actually even when you're eating, you mean your teeth rarely touch. They come darn close, but they don't always touch. But they definitely are not supposed to be touching when you're just going about your day doing whatever it is that you're supposed to do. So just kind of keep that in mind. And so don't get confused that, oh, my teeth are supposed to touch in a certain way. It's like they're not supposed to touch at all unless you're using them for chewing or things like that. If you're using your teeth to clench when you're driving or whatever, that's going to be a problem for you eventually. So, okay, so hopefully that helped. And if you have questions, then comment below or give us a call, come in and see me, and we can see what is going on with you. So have a great day. Thanks for watching. Bye.